What does full informed consent for bupropion look like? My name is Dr. Zadden. I'm a board certified adult psychiatrist, and I'm doing a series where I go through each of the most commonly prescribed psychiatric medications, and I show you what the informed consent process should look like, or at least how I do it. Of course, I'm sure there's room for improvement, and if there are things that I missed, please share them in the comments below. So today we're talking about bupropion, otherwise known as Wellbutrin. Wellbutrin acts a little differently than the other antidepressants. It does not have much serotonergic activity. It acts mostly on dopamine and norepinephrine. For this reason, it's often used in conjunction with another antidepressant because there's not much interaction. They're safe to take together in general. This medication can be especially helpful for people who have bipolar disorder because there's a lower risk of triggering mania because it does not act on serotonin. It also can be stimulating and can help with concentration. So it is used off-label for individuals with ADHD who either are insufficiently treated with stimulants or cannot or don't want to take stimulants. It also has a separate FDA approval for smoking cessation. So for those individuals who are trying to quit smoking, it can be a good option. And it also tends to decrease the appetite as opposed to most other antidepressants, which have a greater risk of causing weight gain. Side effects can include things like headaches, dizziness, insomnia. There can be GI upset like nausea, vomiting, diarrhea, constipation, but it's less common with the bupropion as opposed to something that's serotonergic. Although it can be helpful in some individuals who have anxiety, it can also make anxiety worse for other individuals, and it can be kind of activating or agitating. So if you're noticing increased irritability, let me know. I also recommend taking it in the morning because it's activating, and so it can affect sleep. In contrast to the other antidepressants, Wellbutrin is relatively easy to get off of. The withdrawal symptoms tend to be more short-lived, but each individual is different. And so if we get to a point that you want to decrease or taper off of the medication, we'll just have to take it one step at a time. And if you're noticing anything, then we should talk about it. And of course, after all this, I would ask the patient what they thought about taking the medication and if it seems like the benefits would outweigh the risks for them. So if there's another medication that you want me to do an informed consent process on, please put in the comments below. Wishing you all good mental health, and I'll see you in the next one.